Hello, welcome, and thank you for being part of WorkSafe's Managing the Way Work is Done to Improve Psychological Health and Safety webinar. My name is Cameron Ling, and I'll be your host for this session. Today, I am joined by Melissa Yong, Senior Psychological Health and Safety Specialist for WorkSafe Victoria. Welcome to you, Melissa.
Good morning, Cameron. Thanks for having me.
Great that you can join us this morning. Also joining us is Danielle Moss, Consultant for Thriving in Health. Good morning, Danielle.
Good morning, Cameron, and hi to everyone.
It's great to have you with us. Also joining us is David Stanley, Director, Convenience Advertising. Welcome, David.
Good morning, Cameron. Happy Friday, everybody.
Yes, happy Friday to you as well. Thank you to all three of you for joining us for this really important conversation. And this morning we'll discuss the most effective way to improve psychological health and safety is to look at how work is done. WorkWell's Mental Health Improvement Fund has shown that simple changes to workplace policies, procedures, system of work design can make a difference to psychological health and safety. In this webinar, we will look at how shifting the focus from individual coping to systems and work design can improve that psychological health and safety. Today, we're going to explore the following key topics with our experts: challenges, successes, and practical insights to help your workplace take the next step towards a mentally safer workplace. Improving the way work is done can ensure a good balance between demands and resources that protects workers from psychological injury. Well, when it comes to psychological health and safety at work, we tend to associate the problems or solutions with an individual worker. We think about all the money spent on wellbeing programs to teach our workers the latest strategies for coping with the changing demands of work. And while these programs are helpful, they are not the most cost-effective or sustainable solution. This is because teaching an individual how to be more resilient does not deal with the factors that may cause a psychological injury in the workplace. Melissa, I'd love to start with you. My first question is, what exactly do we mean by systems of work?
Thanks, Cameron. That's a great question to start the webinar today. In regards to a system of work encompasses the way that work is planned, organized, and done. And this may include the interacting set of policies, procedures, practices, equipments, materials, and the environment. So having said that, it is also not only having the different components of it, but it is the interaction between all these components that is important to make up the system of work. For example, a workload management system may include staff rostering, the rostering processes within it, the employee skill mix. It could also include task allocation, proactive supervisory check-ins, as well as accompanying policies and procedures in regards to workload management. And note, in regards to that, the policies and procedures itself is not a system of work.
Thanks for that, Melissa. Certainly a whole of systems approach there. Can you tell us what we mean by work design? What do employers need to think about?
Great question there, Cameron. In regards to work design means the equipment, the content and the organization of an employee's work task activities, the relationships between it, as well as the responsibilities within a job overall of each individual as well. When we're out on work sites, we would advise duty holders to focus on work design, as you previously mentioned as well, in regards to, looking at the factors in the workplace. It's not just from the individual. There are factors in the work design that may lead to psychological harm. So we would ask duty holders to focus on work design by asking them to give due consideration to the equipment that the employee uses to undertake the role, to consider what and how employees undertake the tasks associated with their role. For instance, it could also look at who they work with and how they interact with each other, and what are the responsibilities for each employees as well. When we look at, for instance, workload management or high job demands, there are questions that could be asked. For instance, are there tasks that can be removed or reallocated to reduce those high job demands?
I wonder, Melissa, if you have a a practical example of what good work design might look like?
Yeah, definitely, Cameron. So I think in regards to that, one example that I can provide is in regards to the work design of nurses. In relation to what I just mentioned previously as well, the questions that we might ask in relation to the work design of nurses is that, we could look at which tasks should the nurses do. How much patient care should the nurses be doing in relative to the paperwork or, the balance between the clinical tasks as well as the administrative tasks that nurses are required to do. Look at which tasks should be allocated to the nurses, which tasks should be allocated to the doctors or other medical professionals. What decisions should be made by the nurse and what decisions should be made by the managers or others within the work group as well. Those are all work design questions that could be asked to elicit more information in regards to the work as well.
Thanks for that useful background there, Melissa. Really appreciate it. Over the past 5 years, 25 projects have been funded through WorkWell's Mental Health Improvement Fund across all imaginable sectors. I'd love to turn to you now, Danielle. Can you tell us a bit about your project, Thriving in Health, and what the inspiration was behind it?
Absolutely, Cameron. So Thriving in Health was one of a number of those WorkWell projects funded through the Mental Health Improvement Fund. And it was a really ambitious and collaborative project led by Peninsula Health, but it was in partnership with health services and workplace mental health and design experts. And it targets some of those known work-related factors, or what we call psychosocial hazards, that can be of risk to the healthcare worker mental health and well-being. So, for instance, things like low job control and high job demands, or exposure to potentially traumatic events or content, and also the design of the workplace environment itself. And as an industry of, greater risk, the inspiration to create systems change in healthcare was really deeply shared by everyone who came together throughout the collaborative partnership.
That sounds amazing, Danielle. Well done on everything you're doing there. Can I stay with you for a second? What is the project trying to achieve? Why focus on prevention and work design? Why is this important?
With the actual project, we had 4 different strategies we tried. So, Cameron, this morning, I think it's best if I narrow it down and I'll talk about one of those particular strategies. And we called it the Critical Incident Response Model strategy. And we worked with FBG Group, so some organisational psychologists. So this strategy aimed to protect and promote healthcare worker mental health and wellbeing by designing and developing a model that reflected a systems response to exposure to potentially traumatic events or content. And it was really important for us to understand how to prevent mental injury when work inherently includes exposure to something that might be potentially traumatic. So it's that not if but when scenario. And it was clear from the research that we did that healthcare workers were experiencing really high levels of emotional demand. So through desktop research, focus groups, and the design and the pilot of the model in a couple of health services, we gained a really deeper understanding of the importance of good work design, but also what we need to look at when psychosocial hazards coexist or come together.
Danielle, you mentioned the potentially traumatic event or PTE. Can you provide us an example of one?
Absolutely. So within the healthcare context, so that was the context of the work we did, PTE, so potentially traumatic events, can relate to events or content. So content might be something that someone might read as part of their role. And a potentially traumatic event could be a significant clinical event within an organisation. It could be something like a major disaster or work-related violence and aggression, so exposure to that, or it could even be something that's really personal, significant to somebody. Essentially, when someone's exposed to a strong, potentially traumatic event, so a healthcare worker, for example, they can experience really strong emotional reactions, and that can overwhelm their usual coping strategies and can cause distress. And we've actually pulled together the work we did into a resource, the Critical Incident Response Model Toolkit, which is available for organisations.
Well, on that point, Danielle, can you tell us how might the Critical Incident Response Model Toolkit assist in any of these scenarios you're talking about?
Sure. So the new model is about preparing staff and managers with the capabilities and level of preparedness that they need to manage a best practice response to exposure to potentially traumatic events or, for example, a critical incident. So what it does is equip staff and managers to prevent or mitigate against the unnecessary exposure, and it ensures that the organisation has a system in place that provides the right support to people at the right time. And it moves away from that idea that there's a one-size-fits-all approach is okay. It does include some helpful information about the infrastructure needed, like the scaffolding, to get to the place where you can implement the model. So I'm going to bring up a graphic now, and it's taken from the toolkit, which is available from the website. And it's really quite detailed. So we've split this information across two screens. So I'll talk about it briefly, but please, if you'd like more details, find the resource on the website. So where we sort of start is by understanding where your organisation's level of cultural maturity is at. So assessing the resources that you have, but also the resources that you might need. You might need to find some expert support, for example. And you move on to enlist the help of others. And you could do this by perhaps establishing a working group. And as a group, familiarise yourself with what best practice evidence is out there. We've also got a white paper on the website to sit next to the toolkit to give you some of that practice evidence. And as you progress, you can delve a little bit deeper, conduct a needs analysis across your organisation. So you might look at what you have, your existing practices and processes or procedures, and how they actually match up to the model that we've put forward. If we skip across to the next screen, you're then encouraged to align what you've discovered with what the available evidence and the model is, and identify what you can do to support implementation. Moving forward, you've got those foundations now established to start looking at the training for your staff and managers and educating other stakeholders in the process. So the idea is that we continue to review and revise to get it right for your setting and to ensure that best practice will continue to guide you. And a big tip, obviously, is to pilot this response model in a small area at first before you expand it out across the organisation.
Great. Thanks so much, Danielle. David, I'd love to bring you in now. Can you tell us a bit about your project with fatigue detection in truck drivers and what the inspiration behind it was?
Yeah, thanks, Cameron. Our project was led by Convenience Advertising in partnership with the Institute for Breathing and Sleep and also Monash University. And we chose Hazeldene's Chicken Farms in Bendigo, which are a large organisation, vertical organisation with 31 farms with 6 million chickens, a hatchery with 4 million eggs, and a processing plant that produce and process about 180,000 birds a day. And the project really was aimed at the critical issue of fatigue in the heavy vehicle industry. By way of context, there are about 3,000 trucks that leave the Greater Sydney area at late afternoon, early evening, coming to Melbourne. And there are about 3,000 trucks leaving the Greater Melbourne area heading to Sydney each and every day. We know from decades of previous work screening truck drivers, about 18,500 of them, that they're at higher risk for conditions such as obesity, obstructive sleep apnea, and daytime sleepiness, obviously due to working in reverse to their biological clock, which places them at higher risk of fatigue whilst driving, an unfortunate precursor to accidents and fatalities. And I say unfortunate because the data published by the National Heavy Vehicle Organisation shows that 34.8% of truck driver deaths are due to fatigue. And this is all about ameliorating and reducing those harms.
David, who were the risk groups your project identified and how did you develop solutions for them?
Great question, Cameron. When you turn up to a workplace as diverse and as vertical as what this business is, we used a Prevention Express tool to measure the workforce for the 5 chronic preventable diseases across that workforce, out in those chicken farms, in the hatchery, in the production area, and the drivers. And the Hazeldene's truck drivers and the processing teams, those people that hang the birds onto the production line manually, were the ones that were identified in that process as at higher risk. In the truck driving cohort, we found that 3 in 7 of the drivers were at severe risk for obstructive sleep apnea, and that the chicken hangers, we found that the lighting conditions were having an adverse effect on their mental health. On the truck driver side specifically, which is the project we're discussing today, we saw a solution in fatigue detection technology, which identifies when the driver's eyes have been closed for 1.5 seconds or more and triggers audible alarms and seat vibrations to alert them to that dangerous fact. We moved with the great support of Hazeldene's and fitted detection technology that identify those events, those where eye closures are 1.5 seconds or greater. They're then human verified in real time and then sent to the database at the Institute for Breathing and Sleep, who then reported this data back to the drivers through the Professional Driver and Scientific Project Committee that was established. That being a key piece in this, a little bit like on-ground playing leaders, Cameron. These are the people that are doing this each and every day and each and every night. And if you pick a leadership team from within that driving group, and they are privileged with all of this confidential scientific data, you get the change. Hazeldene's determined at the beginning of the project that any recommendations that the Professional Drivers and Scientific Project Committee came up with, they would automatically support. So they were empowered also by the leadership group of the organisation.
And David, I believe you've got a couple of graphs that really demonstrate your results nicely. Could you talk us through them?
Certainly, Cameron. The first graph is in that particular phase where you're looking to identify the problem. So the bottom axis is kilometres travelled. So where you've got that circle, you can see that's the 100 kilometres. And then the vertical axis is your eye closure. So you can see in that graph that in that period, 122 kilometres were travelled whilst the driver's eyes were closed for more than 1.5 seconds. And you can see the cluster is at the 100 kilometre an hour piece, which that's really 122 kilometres travelled whilst fatigued, the equivalent of driving from Bendigo to Shepparton with your eyes closed. Moving to the second graph, it shows the effect of the fatigue detection technology intervention. So now once these alarms and seat vibrations are turned on, you can see that all of that risk between the 1.5 second eye closure and 2 second, obviously, is removed because the seat has vibrated, the audible alarms have come on, and the driver has reawakened. The graphs show us how effective fatigue detection technology can be, reducing both the number of incidents of fatigue as well as their severity. 2 seconds, 3 seconds. We had one that went up to 8 seconds. And this is the first step in setting about to reduce with professional drivers that 34.8% of fatalities.
Yeah, I must say, David, congratulations on the impressive results so far. That is a huge change. So well done to you and your team with what you're doing. Could you talk us through the change management process with this? How did the truck drivers respond to the monitoring system? What worked and perhaps what didn't work?
Look, it's a great question. And it's about the equity of data. This is personal data, if we're talking about fatigue events, and it brings in layers of driver suspicion, what may happen with this data. And as was suspected at the very beginning, there were misguided and incorrect feelings that the company might be installing this equipment to spy on them. And putting the first 12 machines in, ironically, there were 4 incidents where machines were damaged. And crucially, it was the on-ground playing leadership group that stood up here. When they saw this data first, this is confidential data about their colleagues' health, and they took action. They demanded that a warning be sent to the full driver community group in the company, to all of the participating drivers, talking about what the consequences would be if any of this equipment was damaged in the future. What worked was exactly that the attitudes were changed by the leaders, the professional drivers. They were firstly acknowledged as professional drivers, and they are. They were put in charge of this project ahead of the scientific committee, ahead of the C-suite of the organisation. It was in their hands to see data first and then create recommendations about that data. For us, we wanted to understand a day in the life of a truck driver so that we knew how best to guide that. And this was really about multiple meetings. We had 12 meetings on site. We did screenings overnight. So they saw us working in their work world and listening to them at 2 and 3 o'clock on a Sunday morning about the trials and tribulations that they were facing, so that, you know, an Australian truck driver is a hard-working person and they can pick a fraud at about 200 metres. So in seeing that, they could see that they were involved, and that gave us critical insights into the world of a driver and what they were up against in terms of workplace hazards.
Well, thank you for that, David. What are the next steps for the project, particularly in regards to system level change?
Great question, and it really goes back to the, you know, Victoria leading the world, you know, seat belts and all of the technology that we've seen through our lifetime. That's the challenge here, and our collective ambition, and I'm talking about, you know, WorkSafe, the Victorian Transport Association, the Transport Workers Union, and all professional driver organisations. We want to ensure that fatigue detection technology is accessible to small and medium operators. Most of these businesses and these 3,000 drivers that are taking off tonight for Sydney, they're single owners or small companies with 3 or 4 trucks. And the average cost of this fatigue detection technology in Australia is circa $2,000 to $2,500 CapEx, and then about $80 to $100 per month in monitoring that, so that this data that you've seen can come back to the organisation. What we want to do is see those costs reduced. We want to see that data go to the driver in the first instant. So we've partnered up in this next phase with the Bionics Institute here in Victoria, the Victorian Transport Association, and Peter Anderson and the leadership team there, unions and others, to develop fatigue detection technology by way of an app that can be used in smartphones. One of the weaknesses here was the technology that currently exists in Australia is truck specific. We need it to be driver specific. So 90% of smartphones by next year will have face detection technology, so that we're able to send to the driver immediately live a notification that they've had a fatigue event, and then longitudinally in their app, they can have a look and say, that's interesting, because 3 years ago, I only had 1 or 2 of these a month. I'm now having 2 a week. And they can do then a screen, the Epworth Sleepiness Screen, and if it comes up red, it'll suggest that they go to their GP and get immediate attention. So our aim over the next period is for the data to go to the driver and the company simultaneously, so both can uphold their duty of care and work readiness and their obligations both to their families and the community, and help the driver take charge of their own fatigue management. And our ultimate goal is for this fatigue detection technology to be installed in every truck in Victoria and Australia-wide, in line with the European Union guidelines, which now stipulate that all new vehicles be equipped with this technology from 2024.
Well, hopefully you achieve that, David. Good luck with all of that. It certainly sounds like a winner that you're onto there. Back to you, Danielle, if I could. I'd like to just ask you now, what were the challenges your project faced, and how did you overcome them? If you could summarise that for me, that'd be great.
Sure, Cameron. I think, you know, by far the biggest challenge was actually implementing our project during a global pandemic. And it was conceived in a pre-pandemic context, but then we were looking at implementing it in a totally different one. What did happen, though, was the pandemic actually elevated the need to protect and promote healthcare worker mental health and wellbeing. And it was a time of really unrelenting and incredible demands for the sector. So I think we all recognise the importance of the work. And so we continued to work collaboratively and really had to respond to shifts in the system. But we did have to work a little differently. So we had to build in greater flexibility and adopt a really more iterative approach to what we were doing. But that ultimately ultimately was a great way for us to ensure that the work continued to reflect what the real-time experience was for people. And we were able to work with changing workplace dynamics and remain aligned to best practice. And I think, the health sector already face demands and really respond to them. So we're able to leverage off that as well.
Great learnings there, Danielle. David, if I could bring you back in on that just really quickly, what were your project learnings?
Thanks, Cameron. Through this project, we learned that the attitudes could be changed through taking the time to understand the audience and ensure the project was designed for the drivers, by the drivers. So through our professional driver and scientific project committee, just like in football, on-field leaders are critical in driving team success through driving standards throughout the playing group. For us, the professional drivers served that role, advocating for their fellow drivers or co-workers, calling out and correcting bad behaviour when necessary, such as the example I gave earlier with the machines being damaged, ensuring that their voice was heard when it came to forming the recommendations of the project. Our major learning, however, was that fatigue data needs to be given to the driver and the company simultaneously. Continuing the football analogy, players now have all the data they need to perform at their best, and they can take ownership of how they can better drive their performance, be it through fitness, strategy, or otherwise. Truck drivers are prevention-focused through the way in which they manage their trucks and deserve to have immediate access to their fatigue data so they can make adjustments accordingly to ensure they get home to their families.
Great, thanks for that, David. Melissa, if I could just come back to you from a WorkSafe perspective, what would you like the audience that's joined us today to take out of this? Are there any actions you would like to see them change, implement? What do you want them to do with this information?
Thanks, Cameron. Good question. From a WorkSafe perspective, when I mentioned about work design, I think what we would like employers to focus on is to focus on good work design. We know that work design is a key way of ensuring health and safety in the workplace. More importantly, good work design can eliminate or reduce exposure to psychological harm. It also enhances health and well-being and improves business success by increasing productivity. So a key takeaway from that, if employers could or duty holder could look at their work design, look at how they could look at implementing, eliminating or reducing psychological harm by implementing good work design. WorkWell has a toolkit from WorkSafe website, which is a great resource that provides access to practical resources, tools, and information for duty holders to prevent mental injury in the workplace. WorkWell focuses on prevention. It is tailored and designed to leaders and health and safety representatives for small, medium, and large businesses. Our website has also an array of valuable resources and guidance available, so go on to the WorkSafe website to access those resources.
Right, thank you, Melissa. I'd love to get to some questions now for our panel because we've got a lot of questions coming through. Really appreciate everyone who's joined us engaging here, and I'll get to as many as I possibly can, but I'm going to start with this one, Danielle, and steer it towards you, but please feel free, any of you, to jump in at any stage if you've got something else to add. A lot of people wanting the answer to this one. People have different tolerance levels when it comes to work demands. How do we practically cater for this, Danielle?
That's a really great question because, Cameron, my background is actually in health. I'm a social worker from a hospital context, and I really understand what high job demands can be in a workplace. And I think if we take Melissa's approach from that work design, I think one of the greatest things we can do, and I know it's sort of been talked about, is data, sort of to understand what data exists to help us with understanding what the work demands are like. But we also understand too that people come to work with different levels of experience. And so people also need to ensure that they have, when we think about how we manage these hazards, the right support from people, the right training and education that they might need, that great leadership from people around them and relationships. And I think it's that monitoring process of demand. So if we understand from a data perspective that we might already have existing data, what is the load like at the moment? What's happening? We need to understand a little bit too about, when we have work, some work may be more demanding than others, in a clinical context. So there's a whole lot of factors which makes us understand the recognition that multiple psychosocial hazards can present at once. So if we understand demands, we can also understand what resources are available to that person. I think that's a great place for us to start.
Great, thank you for that, Danielle. Melissa, I might steer this one to you, this next one. What have you seen in terms of early intervention strategies that aim to reduce the occurrences of psychological harm?
In regards to early interventions, I think I'm not sure the question is directed to, but I'll put it in regards to prevention, in regards to preventing psychological harm, if I do understand the question correctly. In regards to, I've seen organizations, a lot of organizations are actually looking at psychosocial hazards, identifying psychosocial hazards in the workplace early, before it turns into a risk to employees. So identifying psychosocial hazards, whatever psychosocial hazard that's been identified in the workplace, it could be high job demands, it could be aggression and violence, it could be low job control or lack of role clarity for organizational justice. Then organizations would then consult employees to identify potential controls that need to be in place to control those hazards so far as reasonably practicable. And then review and assess that process again once those controls are implemented. So in regards to that, that takes a more of a preventative approach to identify the hazards and the potential risks in the workplace, and putting in controls to potentially, ideally, eliminate, if not to reduce those risks so far as reasonably practicable.
Melissa, if I can continue on with you, and it may be an extension of what you've just been talking about there, this question a lot of people asking, the focus of our business is around the wellbeing process, wellbeing aspects, i.e. EAP, resilience training, etc. How can we get them to pivot to focus on addressing the hazard?
Yeah, exactly. That's a really good question. I think we do see a lot historically as well in regards to EAP as a form of support. However, we know that EAP is a more reactive process. It happens once the harm has potentially occurred. So it's more about bringing back the control measures into a preventative method, focusing on, as I mentioned earlier on, going back earlier in the piece, focusing on identifying the hazards in the workplace and identifying tailored solutions, potentially looking at job designs in the first place to identify and eliminate or reduce those risks so far as reasonably practicable. Having said that, we do need other reactive approach such as EAP as well, but that comes in place in addition to all the preventative measures that's in place as well. So it's more of a holistic approach that employees should be taking. It's a multifactorial approach as well, and it should be tailored and targeted to the organization. So we know that different organizations would require different intervention strategies. Small, medium, and large businesses would have different intervention approaches as well. So it needs to be targeted, it needs to be tailored to the organization.
Great, thanks, Melissa. And the next question, I'm happy for any of the three of you to jump in here because David and Danielle, I don't know if out of your projects you've got an answer to this as well. But this one, a number of people asking, what can be done to address the psychological impacts to an employee when part of the cause of their distress is the relationship with their direct manager? Who's best to take that one?
Sorry, Cameron, I'm not able to take that.
Melissa, go for it.
If you can repeat the question again, Cameron, sorry.
I can ask that one again. What can be done to address the psychological impacts to an employee when part of the cause to their distress is the relationship with their direct manager?
Yep. So I'll jump in first. In regards to that, you mentioned about the relationship or the conflict between the direct manager. As what I mentioned earlier on as well, in regards to the duty holder or the employer, we would expect to have a system in place in the workplace to have identified those conflicts in the workplace and manage those conflicts appropriately in the very first instance, and to put in controls so that the harm is not ongoing. In regards to that as well, if a duty holder has appropriate systems in place, we would expect that those issues would be able to resolve early on before it leads to harm towards the individual. A lot of times we see that actions aren't taken in the very early instance, where it could potentially be resolved and actions to be taken based on the systems that's in place. However, a lot of times it's not actioned within the workplace, and then it leads to more issues and ultimately psychological harm towards the individual that's involved.
And Cameron,
Sorry, David, go for it.
No, go ahead, Danielle, after you.
Thanks. And I think too, it's really important, as you say, Melissa, with our work design, it's making sure that in our organisations we have systems in place where our workers can approach somebody, can provide that feedback. So by having a system that's robust, that might explore what the current system looks like and making sure there's some protective measures in systems, reporting systems, but also ensuring that there are other pathways for people to provide some of that feedback or concern. So there are some organisations that have taken up practices, for example, like having whistleblower hotlines. So there's actually a mechanism that someone can put in place where staff can actually contact somebody and feel safe when they're doing that. To ensure that the feedback does get to the organisation. And then, as Melissa said, systems should be in place for that process then to be managed appropriately. But I think it is really important that we do understand that there's multiple ways that we can look at how we can design the system so that people can feel comfortable providing feedback, and that the system's set up to provide that early support so it doesn't progress to something that could ultimately lead to psychological harm.
Yeah, and footnoting a slightly more indirect version of this in the project that we're involved with, it's where the data goes. So it's the putting of the system and the embedding of the initial system. So, for example, before this project, what would happen is if there was a fatigue event that went beyond a certain point, there would be a person that might ring from Texas directly to that driver's mobile phone, and Australian truck drivers don't quite take kindly to that because they might have been trying to negotiate a farm gate, but the person who's looking at a data point out of Texas making a well-intended reach-out call doesn't see it in that context. So now we've got some alienation, well-intended but alienated, and then it might go to the driver supervisor who might not be on that night, so they'll then have an intervention the next day, which is what drove the damage of those machines. What we learned was if the professional drivers leadership team are involved in how this technology is adopted, if the driver gets their alert and is able to watch the alerts and empower themselves, those unintended consequences, I mean, we have no doubt that the technology was put in with the right consequences but not measured, but it didn't have the voice of the playing group, if I could put it that way, in its embedding, and it didn't have the review process looking for those unintended consequences, which basically took a really good piece of technology and alienated it, because there was a view amongst some of the drivers that, oh no, there's someone sitting at home just watching every move this driver's making, which couldn't be any further from the truth.
That's a really good point you make, David. And I wonder if this next question, you could just expand on that point a little bit more. How do you bring about workplace culture change to make the workplace more psychologically safe in small workplaces and in large workplaces? The initial steps.
Great question. I think the initial steps are all about, I'm not trying to be cute here, but it's about 2 ears and 1 mouth. It's about really listening a lot of the experts and the drivers of change are the on-field players, the drivers in this case in our project. And if they are privileged and you get a group together of senior leaders within that driving group, you're going to have a much better chance at getting good data backwards and forwards as you set, either in a small workplace or, in the case of drivers, a remote workplace, that it only takes 1 or 2 seconds. In Australia, on the B roads and the A roads, only 1 or 2 seconds for the whole time that person's at work for them to be in a very serious position. And if that's elevated, it's only that professional driver group that can, in our opinion, that can really keep us focused on that most important risk and the mental health challenges around drivers who know that risk exists every single kilometre that they drive.
Great, thanks for that, David. Melissa, I might steer these couple of questions to you from a WorkSafe perspective. A number of people wanting the answer to what can be done for employer repeat offenders for causing mental injuries to employees?
In regards to that, as per our Occupational Health and Safety Act, employees do have a duty of care in regards to ensuring a safe workplace for employees. They're part of the Act that ensures that the individual themselves should not knowingly cause harm to another person as well. So in regards to that, if an employer is found to have contravened an act a Health and Safety Act, they could potentially be prosecuted in regards to this. So, for instance, in the case of employees, whether it is not having appropriate systems of work in the workplace to manage inappropriate workplace behavior, or the employer is deliberately causing harm to someone's health and safety. So there are consequences to it if there are breaches to the Health and Safety Act.
Great, thank you, Melissa. I'll stay with you for this next one too. A number of people wanting to know, what is the status of the psych health regulations and code that were proposed for mid-2022?
Yeah, in regards to that, currently, just going back currently, I just want to note that within our current Occupational Health and Safety Act, employers do have an obligation in regards to ensuring a safe work environment that is including health and safety, including psychological health. So currently, all employers do have an obligation to ensure a safe working environment for employees. In regards to the proposed psychological health regulations, currently the Victorian government is considering options for the development of the proposed regulations, a compliance code, as well as guidance that will come along it. WorkSafe will inform stakeholders in regards to the status as soon as there is update in regards to this area. In regards to the timing of the commencement of the proposed regulations, this is yet to determine. Again, we will update stakeholders about the timing as soon as possible. In regards to that, for stakeholders who want any updates in regards to the proposed psychological health regs, I would encourage everyone to register for updates through emailing legislation@worksafe.vic.gov.au.
Great, thank you for that, Melissa. Danielle, I wonder if I could bring you in on this next question. How can you manage staff reluctance to raise risks with HR because of the process they need to go through?
Look, I think one of the findings, and that we know from working with WorkWell, was the really importance of, once we can get processes, procedures, and the like in place, that we're more likely to create an environment that is what we call psychologically safe. So once those processes are in place and people can have trust. They recognise that, there's the fairness in the policies and the procedures that are in place to manage that. But we would hope that people would be more comfortable in actually approaching those that are there in organisations to be able to support them with managing any potential identified hazards. But we do know that psychological health and safety is, that concept is relatively new, that we're well, I guess, versed in that physical health and safety. So I think over time, once we provide a language and support and we get the regulations and the guidance material, that organisations will understand their obligation, and they will be able to work to create, with those materials, those processes that are in place to ensure that people feel that approaching, for example, the HR professionals is safe, is confidential, and that there are processes in place that that are fairly administrated across the organisation to support them with their concerns.
Great, thanks, Danielle. I am conscious of time. I know we're running a little bit over. We've got so many questions coming through, so much great engagement from our audience. Maybe I could ask a couple of quick ones and just try and fire through as many questions as I possibly can. And this one may be to you, Melissa. Is legislation now active in the state of Victoria?
In terms of, as I mentioned earlier on, in regards to the psychological health regs, that's currently still proposed. It's not currently active. However, with our current OH&S Act 2004, it includes psychological health. Therefore, employees do have a current duty to ensure the health and safety of employees within the psychological health context as well.
Great, thank you, Melissa. And maybe David or Danielle, relating to your projects for this one, how to manage burnout when people have different stress thresholds and therefore a different workload capacity without causing unfair distributions of work? Who's best to answer that one?
I'll venture forward.
Thanks, David.
Given it's Friday. It comes back to that leadership group. It comes back, if you've got a cohort of truck drivers or you've got a cohort of people that are hanging birds in a production line, it's about having that leadership group, those more senior, and I'm able to say that, the grey-haired group, if you like, and empowering them to watch for that. And to, rotate their people. The perfect example in our project was the chicken hangers. There's 4 guys that have got to hang about 12,000 birds. This line goes at 12,000 birds an hour, and there's no technology to put those birds onto that line, and it relentlessly goes. So it's about that group looking out for each other, and the senior leaders in that making sure that after 15 minutes, they're looking for fatigue. They're looking for the person that's just a little, off their game that day, and making sure that they can tap out and feel safe about that.
Great, thank you for that, David. I'll just ask this one perhaps to you, Danielle. It's a tough question, as a lot of them have been, but how do you help a team recover from an employee that has impacted the whole team?
Look, I think obviously I speak in a health context here. That's, my practice experience. But I think, David's tapped in the real importance of leadership in this context, of being able to have a leader who is confident and supported and has, I guess, the experience and the training to support them to do that. There is, I guess, a lot, having been immersed in this space over the last 4 years with psychological sort of health context, is also having a look at how we actually need to acknowledge, different hazards and have different mitigations in place for those. So I think as an organisation, really important to sort of start to understand what they may be, and then start to ensure that, we've got the leaders with the capabilities they need, we've got the processes and procedures in place that people need to manage that. And I think that will bring strength to be able to do that. But I do know that it can be hard leading a team, and I think we need to make sure that we support our leaders as well. They have an incredible role within organisations. They have a credible responsibility for people, and we need to ensure that the same support we give our workers is also available for our staff to build those robust systems.
Great, thank you for that, Danielle, and thank you so much for all those questions that are coming through. I understand we went a little bit over time, the allocated time, but I thought it was important to get through as many questions as I can. there are still tens of questions on my screen here. So I apologise to those who I haven't been able to get to their questions. If you do have anything that really needs attention or you'd like an answer to, please use the WorkSafe advisory line to find out that information. Again, I apologise that I couldn't get to every single one of those questions. It's great to have so much engagement this morning. A huge thank you to our expert speakers for joining us today to take the time out of their days. WorkSafe's Melissa Yong, thanks to you, Melissa.
Thanks, Cameron, and thank you everyone for joining us today.
And a big thanks also to Danielle Moss from Thriving in Health. Thanks, Danielle.
Thank you so much, Cameron.
And also a big thank you to David Stanley from Convenience Advertising. David, thank you.
Thanks, Cameron.
I really appreciate all of your time. We hope that everybody has found this a really interesting and informative session. If you have any requests for further information, we do recommend you to please get in touch. And if there is something that you want to discuss urgently when you are back at work, there is the WorkSafe advisory line I mentioned, but also the emergency line. So please utilise those. Thank you so much for being a part of this webinar. All the best.